No country nor city was ever prepared for the coming of the pandemic known as COVID-19. Not even the Philippines, including Iriga City, have anticipated the possible ill effects of this health crisis. We were caught off guard. There was complete struggle. The outcome was debilitating. In this time of difficulty, now we need a helping hand, that we seek for aid and we look for every possibility that would eventually lead to a solution to the presenting problem. The number of COVID-19 cases rose day by day. Thus, the need for stringent policies and preventive measures became a requisite, and we seemed to lose optimism, but chose to remain resilient and hopeful that one day, everyone will be on their feet and find their way to our aid. Iriga City, under the leadership of our very indefatigable and hardworking city mayor, Honorable Madeleine Yorobe Alfalor, found it fitting to holistically address the people's needs. Other than the 47 issuances regarding COVID-19, which includes city ordinances, executive orders, administrative orders, memorandums, and advisories, she came up with the initiatives that will assuage the ill effects of the pandemic. During the pandemic, the appeal of buying from local farmers is not just about values, it's also about security. In January of 2020, Iriga City farmers started planting local products, and in time of the enhanced community quarantine, the Iriga City government, through the Office of the City Agriculture, directly buy their agricultural produce at farm gate price. Thus, the creation of the Vegetable on Wheels project, which primarily aims to assist the local farmers to earn and maintain their livelihood. The Agricultural Office of the city facilitated the pickup of the assorted vegetables from the farmers and distributes the products to the 36 barangays of the city for selling in their barangay satellite market, and some were distributed to the local constituents for free. Because of its timeliness, the Vegetable on Wheels evolved into a rolling store where all commodities are available. Vegetable seedlings were distributed to the residents for free to encourage Irigueños to plant vegetables to be self-sufficient and food secured, and to elevate it a little further. The Saudan sa Barangay or satellite market was implemented in partnership with the vendors who live in the barangays. They no longer need to transfer their merchandise to the public market, but instead sell them to their own villagers. Similarly, the people in their community need not to go to the public market to buy their daily needs. Having access to a sufficient quantity and affordable food is never a problem in Iriga City. The city government of Iriga also launched the first and only contact tracing app in Bicol region and even in the whole Philippines, wherein by using the technology developed by the city government, contact tracing of all the people in the city is fast and reliable. And the current development of the online unified RFID that will provide services to all clients online on all local government transactions in preparation for the new normal. The main public transportation in the city is the tricycle. Iriga City has 2,000 registered tricycle operators and is one of the major sources of household income. But because of the declaration of the enhanced community quarantine in Luzon, mass transportation has been suspended, thereby affected their source of income. However, they worry no more because the city launched the Toda Rescue Project. The Tricycle Operators and Drivers Association of the 36 barangays in the city were tapped as partners to man the checkpoints along boundaries and become force multipliers that started on March 23, 2020. They have undergone trainings on rescue conducted by the DRRM, and their increased level of awareness capacitates them to handle accidents or disasters. Primarily, they help check and validate quarantine passes, certificate of exemption, and implement the ECQ regulations to all motorists entering or leaving the city. 100 tricycle drivers were hired and paid by the city to help augment their income in time of crisis while mass transport is suspended. Clearly, they are also considered as heroes for their service and for putting their lives at risk to help the city fight the COVID-19 crisis. The community quarantine guidelines is issued by the national government with regards to the minimum health standards, particularly social distancing, limits the number of passengers allowed in both public and private vehicles. Backriders were prohibited too. The result is remarkable, increase in public transportation costs, which took its toll especially to the minimum wage earners. Putting all this into consideration, a plan to aid commuters was put into action. iRide was launched through the initiative of the extraordinary Mayor Madeline Yorobialfilor and the efforts of the LGU Iriga. iRide addressed two pressing concerns. First, it gave livelihood to the most vulnerable sector of the society, the transportation sector. And second, it provided free shuttle service to all essential and non-essential workers in the city to alleviate the high cost of transport. A sanitized, just-in-time transfer service for workers, ensuring that they will be able to report for work and return home safely. Minimum health standards are practiced by every commuter. They have to wear masks, present company ID or contact tracing cards with QR codes issued by the local government unit of Iriga and should be seated on the marked seats only. It is still ongoing, following its daily schedules via 3 routes. A breakthrough project para sa manggagawang Irigueño. As the number of COVID-19 positive cases increases each day, and as there is an influx of locally stranded individuals going back to their respective provinces, cities and municipalities, every LGU has to be prepared for what is inevitable. The city government of Iriga did just that. As soon as GCQ was declared, our quarantine facilities have been organized and is already fully functional. There were 10 quarantine facilities and 60-room isolation facilities with 213 bed capacity. Most, if not all, of the people admitted in the quarantine facilities are locally stranded individuals, returning overseas Filipinos, and authorized persons outside of residence. They follow certain protocols and comply with the requirements needed for them to be allowed entrance to the city. Medical clearance certificate, negative RT-PCR results, travel authority, and certificate of employment, to name a few. All LSIs with no swab test are obliged to a 14-day quarantine at the quarantine facility of the city, thus approved by the Department of Health. The city mayor, together with the LGU team, caters a holistic program to all those admitted in the quarantine facility, such as early morning Zumba for physical conditioning, values formation, livelihood and agricultural training, and sports reintegration program. This provides those in quarantine the opportunity to learn, to earn, and keep their immune system healthy. Not your ordinary quarantine, only in Iriga City. While everyone is facing this dilemma, the city government of Iriga never ceased to come up with ways and means to combat the adverse effects of COVID-19 pandemic. Mayor Madeline Yorobialfilor and the city government of Iriga will ensure that this grueling crisis will come to an end. But this cannot be done alone. You, us, and we have a role to play. Together, we will heal as one.